Okay, good morning, everybody. Thanks for joining us for the Coordinated Entry System overview. I'll start with a kind of general overview of coordinated entry and then get into the specifics about how it works and what are the expectations, and then we'll have lots of time for questions and answers and just thoughts and discussion. So hopefully you can see now my PowerPoint that starts with the coordinated entry system on your screen. And so just a brief overview here that the coordinated entry system, the point is to connect people that are experiencing homelessness with housing providers and supportive services. There are 4 components and aspects of coordinated entry system. There's access, assessment, prioritization, and referral. So the access is it's standardizing the way that households experiencing homelessness can connect with services so that they can go to our virtual front door, which is 211OC, so they can call 211 to be connected with an access point, or they can go to a homeless service provider participating in the coordinated entry system, and their services and access should be universal. And then the same thing for the assessment. We have a standardized assessment here in Orange County. It includes 3 aspects. There's the intake, the VI SPDAT, and then a housing preference survey. And then we have a prioritization process that's reviewed and approved by the COC board. That's the Continuum of Care board. They approve our coordinated entry system policies and procedures. And I'll go into the prioritization process in a little bit more detail later on. And then the referral is the point where we're making a match from the coordinated entry system prioritization list to the housing or service provider, and then they complete their intake and housing or service process. There are 3 components of coordinated entry divided by subpopulation. We have what we call individuals, which is adult-only households. We have families, which are households that include minor children. And we have veteran households that include veterans of any discharge status. From those 3 components of coordinated entry, we pull out the transitional age youth to case conference and match those youth to youth-specific housing resources. Currently, we meet every other week to facilitate that transitional age youth component. Here's the general overview of how coordinated entry system works. We have a household experiencing homelessness. They connect with a street outreach team or homeless service provider. There's an attempt to engage in diversion, which is problem solving and connecting people with housing resources or keeping their housing that they previously had. Maybe they need to repair a relationship or need a quick solution to their quick housing assistance or something to maintain their housing. If that's not needed, or if it's not resolving their homelessness, then they would engage in the homeless services process, which would include a coordinated entry system assessment. Typically that's completed within 14 days of engaging in the system. And then once the household is in coordinated entry, they're included in our weekly housing match meetings or case conferencing. So then every week we meet as a community. There are over 40 homeless service providers that participate in those meetings. And we prioritize and go through the matching process by triaging. Because the need is greater than housing resources, we have a prioritization process that identifies the highest priority households to be matched to the available housing resources. And so you can see that the available housing resources that we discussed during the coordinated entry meetings are permanent supportive housing, rapid rehousing, housing choice vouchers, commonly referred to as Section 8, affordable and community housing, and then temporary housing or behavioral health programs. If they're at any of the first 4 categories there, they are considered permanently housed, and they would then be outside of the scope of coordinated entry and are working towards maintaining their housing. So here's just some contact information about how to learn more, if you visit homeless.egovoc.com, or if you have a household that needs assistance and you need to direct them to an appropriate access point, you would have them call 211, or you can call together. Or you can email us at coordinatedentry@ochca.com. Same thing if you need any of these materials that I'm going to go over, or more information about coordinated entry system in general, you can reach out to that email and you'll get me, or Myra Vargas works with me here at the county on coordinated entry. Okay, so there I'm going to take a pause and go through the chat that I've seen some questions come through, and then we'll go into more of the details about how it works. Let's see, so it looks like there's a question about the PowerPoint. So I can email out the PowerPoint. If you're not already on the coordinated entry system distribution list, go ahead and put your email in the chat, and I'll be sure to include you in that email with the PowerPoint and the recording of this video. Okay. So with that, I'd like to go ahead and go into the kind of specifics. So the first step of participating in coordinated entry, for those of you that are on the call and aren't participating currently in coordinated entry, would be to get set up in our homeless management information system. In Orange County, we use Clarity, and it's operated by 211 OC. They are the administrators. So I've pulled up the page that's on their website about how to set up your agency and project. So you would go to there and follow those instructions to get set up as an HMIS participating agency. And then that you could reach out to coordinated entry and let us know that you're set up, and we could talk about what the next steps are to participate in our weekly case conference meetings. So then I'll go quickly over the quick guide here for coordinated entry. We have the individual system, which currently is in the process of transitioning to HMIS, the Homeless Management Information System. So we're currently accepting the assessments through a Google form prior to our implementation in HMIS. So you would go to that link, you would complete the assessment, and then once the assessment's completed, you would start working on the verification documents. We have homeless verification, disabling condition verification, that's if they're reporting a disabling condition. And then the chronic homeless verification is the combination of those two. So you might have multiple verification letters of homelessness that combined equal 12 months or more, or 4 episodes of homelessness in the past 3 years, and the disabling condition. So to be chronically homeless, you must have both, you must meet both criteria, both the length or multiple episodes and the disabling condition. These forms are required for all individual households, so adult-only households and family households. Then for families, they complete the coordinated entry system assessment within HMIS itself. So they complete it online, and then it's added through the system to the community queue or list of, sometimes they're referred to as a by name list of households. And the homeless verification, disabling verification, and verification of chronic homelessness are all uploaded in HMIS just as they are for individuals. The veterans is also currently in the process of being implemented in HMIS. So we're currently accepting those veteran registry submissions through Google Forms. And then we receive them on our end and we add them to the veteran registry. And then we ask that for every veteran, they be referred to the CRRC, which is our Community Resource and Referral Center here in Orange County. It's here in Santa Ana. And I have a flyer later that I'll show you and I can share as a follow-up so that they can be screened for veteran-specific services. We do host weekly coordinated entry system meetings. We host them by populations. We start with our transitional age youth. That one hasn't been added yet to this information here I see, but that's 8:30 to 9:30 is our transitional age youth every other week. And then we transition into our veteran discussion for an hour, then our adult only households, and then we end with our families for that case conferencing so that agencies can participate in the section that applies to their population. If they work with all those populations, they would attend all 4 meetings. And then I just have a list of bookmarks to add. So when you receive these, you can go ahead and add those to your bookmarks if you like. So they're easy to find, those forms and links. Okay, so then the prioritization process here that's currently approved in Orange County, it follows the following priorities. Length of homelessness is the highest priority. So those that are long-term homeless, they're prioritized higher than those that have less length of homelessness. So if somebody's just newly homeless, they would be prioritized lower than somebody who's been homeless for years. We also have a shelter priority. So what this means is we look at the longest term homeless and we consider those that are sheltered first before we move on to those that are unsheltered. The tiebreakers in our prioritization process is the VI SPDAT. So if we have 2 households that are of equal priority, we can use the VI SPDAT to determine which household should be prioritized for housing first. But in general, we use a dynamic prioritization process, which is similar to case conferencing. What this means is we discuss as a group which households would be the most appropriate and eligible fit for the available housing so that we can maximize our housing resources and have it be a successful housing placement. We do use resource distribution in Orange County. So what this means is in Orange County, we have 3 service planning areas. We have the North Service Planning Area, Central Service Planning Area, and South Service Planning Area. So when we receive resources available through coordinated entry, we divide them by the service planning areas according to the point in time count. So generally that gets to be about 40% of the resources are available to North Service Planning Area. That's about Orange, the city of Orange and North. And then 50 or 49% or so are available to our Central Service Planning Area. That's between Orange and Irvine. And then our South Service Planning Area is less than 10% of the resources that are available countywide, and that's from Irvine South. Okay, and then we, as I mentioned, the minimum that's required for being what's considered document ready in coordinated entry is providing the homeless verification. You can use your own letterhead or your own format, but we've drafted a template to use. You're welcome to use this format or your own, but what's critical is that you're documenting and verifying the length of homelessness that your agency can verify. So usually that's at the point of service engagement. And then you would use additional third-party verifications to verify the length of homelessness prior to your service engagement. So if you're a shelter, you might request this third-party verification from the referring agency into your shelter. So if that's a police department or an outreach worker, you would request a third-party verification with the referral, and that way you have the maximum length of homelessness verified. If there are other service providers that have been assisting that household, they can also provide that third-party verification. And then sometimes it's business owners or communities of faith can also provide these third-party verification. We've also drafted a self-certification of homelessness. So this would be the client themselves completing this form, verifying their self-reported length of homelessness. We can use 3 months, a maximum of 3-month episodes of homelessness verified by self-verification. The highest standard is third-party verification, but if a household wasn't engaged in any service providers and there are no known agencies or third parties that are familiar with their housing status, they can provide their self-verification. And so this can be any format that you'd like. We've just provided this template for your reference. Then we have the disabling condition verification form. If they are reporting a disabling condition, they would provide the form, and should be completed by a licensed professional. So it can be a clinician, a doctor, a social worker that's licensed. And they would click the category, and then they should also select, for most HUD-funded housing resources, it's required to be yeses for all three of these questions. But we do have some housing resources that don't require all three to be yes. But just keep that in mind when you have it completed. And then getting into the family system. So this is a brochure that I can include in the follow-up email that is about the Family Solutions Collaborative. They are funded by the County of Orange to operate the Family Coordinated Entry System. So they lead and facilitate the weekly meetings for the family households and manage the coordinated entry system for families, which is households with minor children. And then to complete to connect family, if you're not a family access point in coordinated entry, to connect a family with the Family Solutions Collaborative, you can assist the family with dialing 211 to complete this form over the phone, or the family, or with your assistance, can complete this form online. And within 48 hours is the expectation that a family coordinated entry system access point will contact the household and complete an intake and review their needs and eligibility for participating in coordinated entry. For veterans, here's just the one-page veteran registry form. So this is the information and assessment we request for veteran households. We do want all agencies participating in coordinated entry to be familiar with the veteran registry, so that as soon as a veteran household is identified, regardless of the agency that they're connecting with, we get them on the veteran registry, which is a by name list of every veteran household in Orange County. We currently have a goal to end veteran homelessness in Orange County. So it's critical that we identify those veteran households as quickly as possible and connect them to available housing resources. And then, as I mentioned earlier, we have the Community Resource and Referral Center flyer for veterans. The address is here at 888 West Santa Ana Boulevard in Santa Ana. They are still open, taking walk-ins. They have safety protocols for health screenings, but they are accepting walk-ins, or you can call and have the veteran call to get a screening over the phone. Okay, so that is the quick overview of everything, just so we have enough time to go over questions and have any discussion. So it looks like we have, just gonna scroll through to any questions, and then I can open it up to the floor. Let's see, looks like, so I see a question. Would you like us to complete CS assessment with veterans or just the veteran registry? So yes, for veteran households, we start with a veteran registry. We've simplified the assessment process to be just the one-page veteran registry so that we can quickly identify those veterans and get them connected. We're fortunate here in Orange County to have sufficient housing resources for all of our veterans. And so we don't need all of the details from the full coordinated entry system assessment. So we've simplified it just to the one-page veteran registry. And then, can family members verify, and would it be honored for 3 months like the self-verification? So you can have family members, or sometimes we see businesses do the third-party verification. So it can't be a family member that's in the household that's experiencing homelessness, but it can be an extended family member. So for example, sometimes we see letters where the family experiencing homelessness was previously doubled up or tripled up with a family member, but there was a conflict in the family, or maybe it was putting that household's lease at risk, so they were asked to leave. That household can write a letter stating the reasons that that household had to leave and what date that episode of homelessness began. So that would be considered a third-party verification and not self-certification. So self-certification is just the household themselves that are experiencing homelessness. That's a self-verification. Okay, and then I see a question. So once a VI-SPDAT and homeless verification is completed for individuals, it should be emailed to OCCAS. Will it ever be merged into HMIS? So there's two things there. One is the assessment itself. So the VI-SPDAT is a portion of the assessment here in Orange County. So the full coordinated entry system assessment for adults is submitted through Google Forms. That includes the intake, the VI-SPDAT, and the housing preference survey. And on my side, I received that coordinated entry system assessment, and we add it to the coordinated entry by name list. The supporting documents, which include homeless verification, disabling condition, and the chronic homelessness verification, those are uploaded into HMIS, and then there's not a notification system in HMIS to notify us that those forms have been uploaded. So we ask providers on the serving adult-only households to email coordinated entry system so that we can update the by name list. We are in the process of moving into HMIS for both the adult-only households and the veteran households. So that is currently in the works, and there'll be more information as the timeline is confirmed. Okay, and then you mentioned that the length of homelessness plays a part priority-wise. Do you base that off what is written in the third-party verification form, or does CS itself look on HMIS? So we do base it on what's verified. So the prioritization is based on the verified length of homelessness and not self-reported lengths of homelessness. Is there a website to check if the person is a veteran? Not that I'm aware of, but it's fairly simple to call the the Community Resource and Referral Center. So I'll blow it up here to get the name. The number is 844-838-8300. They would call that, and over the phone they can get a screening. The Community Resource and Referral Center will look them up and see what forms or additional information is needed to determine eligibility, but very often they can determine eligibility right then and there on the phone. Then can a certified alcohol and drug counselor complete the disabling condition form? They must be licensed. So they must have a California license. Okay, and I see a question about getting the forms and documents. Those will be included in the follow-up email. And then, will these new forms replace the old forms? So I think you're talking about the verification forms. So these are just templates. There's not a specific form or requirement in Orange County to use a specific form for verifying the length of homelessness or disabling condition. We just looked at the verifications include the critical information. So if you have forms that include the time that the date that you're verifying from and the location that they were in. So we look for that letter, that information in the letter. Is it an eligible location, and does the date align with the information that was reported? And then for the disabling condition form, there are agencies that use other versions of this form, but it's critical that it includes the disability type and then these three critical questions. So if you're using a different version of the form, but it includes this information, we will accept it. We can also accept disability benefits as verification of disability. So if somebody is receiving SSI or SSDI, that can replace this disabling condition form as well. So Michelle's asking, I'm the housing navigator for Grandma's House of Hope and work with the men's re-entry programs. Where would my clients fall with prioritization if they are entering our program straight from jail? Jail time is not considered period of homelessness, correct? So that depends. So there is for institutions, so jail is considered an institution similar to hospitals or, so any institution. If they were homeless prior to entering that institution and they're in the institution for 90 days or less, they maintain their homeless status upon release if they return to homelessness. So it just really depends on the situation in individual cases. What I usually recommend in the homeless verification letter is just document what's known. And then when we're reviewing it and determining their eligibility and priority in coordinated entry, we will let you know what the impacts are. So if there's periods of incarceration mixed with periods of homelessness and maybe periods of paying for motel rooms mixed with staying with families on couch, just document all that as separate lines, similar to the form. So you would kind of collect like a housing history. You might need more lines to include, at least, I would recommend going back at least the prior 3 years, because that's another way to be classified as chronically homelessness. Chronically homeless is if you have multiple episodes of homelessness. So you would collect each one. What type of housing did they have? The city here, we like to collect that here to see which housing resources they might be eligible for. And then we can figure out whether they're meeting multiple episodes of homelessness or if it's been one continuous long length of homelessness if the institutional stay has been less than 90 days. And then, but I think in addition to your question, you're asking, and if it was, say they weren't homeless prior to their incarceration and they're released now and coming into a shelter or accessing any services, that would be a fairly short episode of homelessness. So they would be lower priority, but it just depends on the housing resources that are available, if they would be prioritized higher for that. So for example, we have rapid rehousing here in Orange County, and often the longer term, the houses that have been homeless the longest often wouldn't be best served by receiving rapid rehousing. So we do tend to go lower in their priority to find those matches. And sometimes it is shorter lengths of stay, such as under a year. Okay, and then the next question is, does income impact prioritization? For example, someone making $950 per month SSI versus a person earning $400 per month on part-time employment. No, we do not factor in income in our prioritization process. It is only length of homelessness, shelter status, VI-SPDAT score. There is a question in the assessment form that asks if they are interested in shelter. I think it's shelter plus care. It's written as shelter in plus, but I think the question is, are they interested in shelter plus care, which is the old name for what we now refer to as continuum of care certificates. What is that referring to? So yes, so that's referring to COC certificates or continuum of care certificates. And those are vouchers with supportive services provided by the Orange County Healthcare Agency. And there's specific eligibility related to their disabling condition. So they have to have a mental illness, substance abuse disorder, or HIV/AIDS to be eligible for those certificates, and enrolled in county contracted services. And I work with the Orange County Healthcare Agency Housing and Supportive Services team to determine eligibility for those COC certificates. And then the next question, is there prevention problem solving services? For example, services for someone who is falling into homelessness. So we do have that. Last year, we had a county-wide training, so all coordinated entry system partners were invited to complete the diversion and problem-solving training. So all of the majority of the homeless services available in Orange County are also trained in diversion and problem solving. And then there's a question about, I would like clarification on the SSI, SSDI income statement replacing the disability verification form. They can show either their income statement or a filled out disabling condition form and do not need both, correct? Yes, that is correct. They just have to verify that they have a disability, and if they've already been approved for disability income, then that's sufficient for verifying that disabling condition. After filling out the veteran registry, where do we submit it? In the past, I've contacted the VA and they have performed the assessment. So the veteran registry is submitted online, and the link is right here, which you'll receive as a follow-up email if you're on the coordinated entry distribution list or you added your email to the chat. So that's submitted online, and where that goes is I receive it here at the County of Orange. And then if they haven't already been verified with the VA, we determine eligibility through the coordinated entry process during our Tuesday meetings, prior to or during the next Tuesday meeting, to verify their eligibility, and then we make the housing match. We confirm the housing match during the Tuesday meeting if needed. But you can also connect them with the VA, which here in Orange County is the VA CRRC. So you're correct that you can also direct them to the CRRC and have them do the intake and screening. But if you'd like to do it faster, you're also encouraged to submit it online so we can get the process started. And then, is the CES application the only way for a client to qualify for rapid rehousing? Are we able to refer clients directly to Mercy House or one of the organizations that provide rapid rehousing? So the rapid rehousing resource, if it's funded by the Continuum of Care or Emergency Solutions Grant, they're required to prioritize through coordinated entry, but there are other rapid rehousing types that are available and funded outside of the Continuum of Care and Emergency Solutions Grant. And so those referrals you would make directly to the agencies that are receiving that funding. And you can, if you're not familiar with agencies, you can call 211 to be connected with that resource. And coordinated entry can help coordinate that too. We often support and coordinate with partners that don't necessarily have all of their resources, housing resources prioritized to coordinated entry, but we often are working closely together and ensuring that we're coordinating those placements. Then what if they are rapid rehousing document ready and they also mark the shelter plus care? Are they only qualified for rapid rehousing? So shelter plus care, as well as all other permanent supportive housing, requires chronic homelessness. So you must have the length of homelessness and the disability to be eligible for shelter plus care. For rapid rehousing, if they're only eligible for rapid rehousing, then that means that they only have the verification of homelessness and either not the length or not the disability to be considered chronically homeless. But if the household is document ready for rapid rehousing, but has also verified the length of homelessness and provide the verification disability, they will also be considered for permanent supportive housing opportunities, including shelter plus care, if they're connected with county services. Okay, I think I went through the questions. So if anybody has anything else, please feel free to unmute yourself and ask a question or make a comment, or continue to add the questions to the chat. I really appreciate it. Yes.
Hey, Rebecca. So as we're entering, enrolling these clients, right, into these opportunities, rapid rehousing opportunities, is there any way, because we have our own case management system, right? is there any way where we could, our team can update the HMIS for the rapid rehousing? And is there a report that we can get from HMIS system that you know of so that we can collect the data and input it in our system?
Yes, so HMIS has a robust reporting system
Awesome.
called Looker reports. And if you need a specific, there are lots of pre-made reports, and similar to this page I showed about getting agency and projects set up, they have lots of resources. You could search here for reports, and they will show you a list of all the available pre-made reports, but you can also submit a ticket to 210C to request a specific report to meet your needs. So if you need data from HMIS that's not readily available, but you've been entering it, you know, it has to exist in HMIS.
Right. That's
but
what I
if
was
it
thinking,
exists,
yes.
yeah, if it exists, then yes, that's encouraged as much as possible to use HMIS as your database and just pull the information you need from there through reports.
Perfect.
Trying to minimize systems here.
Right, that's what I wanted to make sure, right? Because I'm trying to, I can have, you know, my admin person, for example, be the one, right, entering the information in our system, not my case manager. I want our case manager to be focused on the youth, right? So thank you so much. I appreciate the answer. That's great to know.
Thanks, Carlia.
Rebecca, I have a question in regards to rapid rehousing.
Hi, Damien.
Once the VI SPDAT's done, I know it generates a score. Do you guys have a cutoff as far as the score, what an individual is matched to? So is it like an 8 and above cannot utilize rapid rehousing, or does the score not matter?
The score matters, but it's not in the sense that you're talking about, the cutoff. So how we use the score, which is a component of the coordinated entry system assessment here, is to just kind of put people in buckets, so to speak. So when the score is calculated, people will be put into categories in the coordinated entry system based on what they're most likely to need. So if somebody scores 8 and above, once the documents are submitted, they'll be marked as document ready for permanent supportive housing. And if they score below 8, they will be marked as document ready rapid rehousing. But if those in the rapid rehousing category submit the documents for permanent supportive housing, so that includes the chronic homeless verification, which is the length of homelessness plus the verification disability, they are also considered for permanent supportive housing opportunities.
Okay.
So really we use the VI SPDAT score for a tiebreaker. In my experience, we've never really gotten to that point. We almost always resolve anything through case conferencing.
Okay.
But if there is 2 households of equal length of homelessness, we could in theory use the VI SPDAT if we couldn't come to a mutual agreement.
Okay. Yeah, I just wanted to know, like, if there was, you know, any way to advocate or anything of that sort, just in case someone were to score higher, but, you know, when you actually meet the person and all that stuff, they are capable and should be, like, you know, utilizing rapid rehousing instead of getting a voucher, because it is based on their experience and all that stuff and what they're going through. So that's what, you know, technically raises the score. So I just want to, like, I ran into that in the past. So I just wanted to see if there was like any room to flex, advocate.
Yeah, we same thing in reverse. For rapid rehousing, we consider all scores for rapid rehousing. So every household in coordinated entry is considered for rapid rehousing. They may not all be the most appropriate, but we do the same prioritization. We start with the longest length of homelessness, and we just move down regardless of score. And we have specific programs in Orange County that target kind of the mid-range score, kind of 8 to 12 or 13, to kind of hit some of those chronically homeless households that might be able to most appropriately use rapid rehousing. And they tend to be longer rapid rehousing programs, so a year or more might target a specific VI-SPDAT score range, but that's determined by the funder and the scope of work, and then that's how it's submitted to coordinated entry, and we use those
Huh,
requirements to make the prioritization.
Good.
good to know.
Thanks, Ian. And I see a few more questions coming in through the chat. So during the case conferencing and matching, I noticed that there is a column for weighted and it's a percentage. Do you happen to know what goes into that percentage? Is it the length of homelessness? I know that's an old component of the prioritization list. It's a percentage of completeness. So, you know, it's looking at what's that score based on how many questions were reported or completed. So we don't do anything with the weighted score currently. And then for rapid rehousing options, when the time of assistance offered comes up, do they stay in the same unit and pay the full amount of rent, or do they need to transition into other housing? So no, for the rapid rehousing, the goal would be for them to maintain their housing that they've obtained through rapid rehousing. So they might have a three-month rental assistance through rapid rehousing with the goal of being able to maintain that lease and the full rental amount at the end of that 3-month period, or 6 months or 12 months or 2 years, whatever the length of rental assistance is. But the hope is that they will stay where they are. They oftentimes will have a lease in place in their name that they will be responsible to continue and maintain. So if someone is receiving services with the county when they were homeless, however, they enter a sober living, since they are in a sober living, they are no longer homeless, correct? So they wouldn't be matched if they are staying in a sober living. That's correct. They wouldn't be eligible for housing resources that are specifically for households that are literally homeless. And they
I
would
do have a question about that. Can I have a follow-up question?
Yeah, please come.
Thank you. My question would be, if the agency is, if an agency, right, is paying for that sober living as an effort to remove them from the streets, right, while we find housing and placement, if does that count or not?
Yeah, so oftentimes it's like room and board, sober living, places like that are being used by agencies as emergency shelter placement.
Yes, I heard
so
that.
as long
yes.
as the agency is verifying that this is paid by a third party, themselves or a third party, as a means of meeting emergency shelter needs, then it would be considered an episode of homelessness. But we did not have any of the standards of of housing standards be put upon that household. So they shouldn't be paying any portion of rent. They can't have you know, rules and regulations applied upon them, things like that. So it gets kind of tricky, but
yeah,
in general, if you're using it as emergency shelter placement, you know, a good example right now during COVID is the hotel placements. Normally staying in a hotel wouldn't be considered literally homeless, but if it's paid by a third party, then it continues to be, you maintain that homeless status.
Thank you for clarifying.
Rebecca, I have a question. So if we put them in a hotel while we wait for a room rental or an apartment rental, so we don't want them on the street, obviously. So we put them in a hotel. In your opinion, is that a billable to the rapid rehousing grant?
You'd have to review your rules and regulations of your grant to make that determination, yeah. Okay, then should FSPs be registering on the 211 HMIS site, or may we continue to submit information directly to HSS, which is Housing and Supportive Services. So yes, so full service partnerships and many other subcontract clinics with the healthcare agency actually have a different process for participating in coordinated entry. They're not direct coordinated entry system access points. It's the healthcare agency that's the access point, but they coordinate with their subcontractors to have all the applications submitted through the Housing and Supportive Services, and then it gets submitted to coordinated entry. So the workflow is a little bit different. And if you are a subcontract agency with the healthcare agency that's working through the Housing and Supportive Services team, feel free to reach out to the coordinated entry at ochca.com for any specific questions about that process. Or if you're interested in becoming a coordinated entry system access point, you are also welcome to reach out to start that process and have more direct access to the coordinated entry system. And then the next question coming in through the chat is, I understand that the length of homelessness determines the priority for housing. Just to make sure I understand you correctly, a client who is most likely to die on the streets based on their disabling conditions would not be priority for housing over someone who has been homeless for a longer period of time. Is this correct? Well, it just depends. So we look at length of homelessness, shelter, and the BI-SPDAT, and then we have this case conferencing component. So we don't have some communities, they just, there's no interactive component to coordinated entry. It's just who's the top match according to an algorithm, and that person moves forward with a match. Here in Orange County, it's very dynamic. That's why we really require and encourage our coordinated entry system partners to participate in the weekly case conferencing meeting, because that is where the decision's made. So if there's a household that is needing the housing resource outside of our typical prioritization process, that household would be considered and discussed. So if a client has a care coordinator who has submitted the coordinated entry system application, is that client automatically eligible for MHSA, which is Mental Health Services Act housing options as well? So it depends on how the application is submitted. So on the application that comes through Housing and Supportive Services, there are like interest or eligibility categories, and they would have to be completed by category. So one of the categories is COC certificates, which is formerly called Shelter Plus Care. And another category is the Mental Health Services Act housing, or MHSA. Another category is a specific project here in Orange County called Jackson Isle. So depending on how that section is completed, that determines how we record it and track it in coordinated entry, and then use those notes to prioritize for those specific housing resources. And then the question, does it make a difference in the opportunities the client receives if a staff from the place enrolls them on the coordinated entry system rather than the CC the opportunities the client can qualify? I'm not sure that I understand the question, but I'll try to answer, but if you want to add more details or unmute yourself.
Yeah. Sorry, Rebecca, can you hear me?
Yeah, hi.
Hi, so I guess my question is, does it make a difference in the opportunities the client will qualify for if a staff on site conducts the VSPDAT rather than the care coordinator?
No, the whole foundation of coordinated entry is that regardless of who completes the assessment, we want it to be considered mutually by any agency submitting it. So it should all come out the same.
Thank you.
Thank you. Mm-hmm. So can you possibly send a list of those categories to us? We're trying to connect our folks to the various housing resources you mentioned. Most of our folks are building the rapport with us to now connect them to mental health services. Which categories are you referring to? So this is from Manveer.
I have a quick question. Is there any communication between LA County and the other counties with Orange County? Because there is sometimes some overflow of individuals coming into the city who come from LA County. Do you guys just start serving them, or do you guys kind of refer them back and try to get connected?
I guess it depends on, you know, where they're sleeping. So here in Orange County, if they're sleeping in Orange County, we would consider them eligible for any of our by name lists, for adult only, families, or veterans. If they are just, you know, here visiting for the day, or you know, kind of right on the border, we see this a lot. It would be more related to where they sleeping the prior night. So if they are sleeping in LA, they would be directed to connect with their access point in LA instead of Orange County.
Okay. And can you provide that access point? Just because I know that HMIS doesn't communicate between the counties, and I've already ran into that where I knew someone that came here and I still had access to the LA one, so I saw who they were connected to and I just kind of referred them back and got them reconnected because they were already receiving services. It just happened that, like, you know, they took the wrong bus and ended up here.
Mm-hmm.
I was just trying to see if there was like a protocol for that.
Yeah, no, there's not. It would be just like Orange County, LA has a 2-in-1 as well. So if they really don't know who their service provider is, you could direct them to 2-in-1. But like you mentioned, our homeless management information, so we actually use the same one as LA. It's Clarity, but they're not connected kind of on the data side. So agencies in Orange County can't see the LA agencies, and LA agencies can't see the Orange County agencies. Same thing for Riverside and San Diego. It's all separate by the continuum of care. So our continuum of care here in Orange County only covers the County of Orange. Okay, and then to go back to the question from Manveer, looks like there was clarification. So I'll just reread the question and then the clarification. Can you possibly send a list of those categories to us? We're trying to connect our folks to various housing resources you mentioned. Most of our folks are building rapport with us to now connect them to mental health services, the agencies that connect them to care coordinators. Okay, so care coordinators is a role in the county clinics, similar to a case manager, and they help coordinate their care. If you need a list, there is a list on the website, but really I would recommend calling the number for the information referral, and it's OC Links. It's 855 OC LINKS. And that's the information referral system for behavioral health services. And they can be referred and connected with a clinic or service provider that can help them with their behavioral health needs. And then to confirm if they were experiencing homelessness in another state for about a year, will OC honor that episode of homelessness? So all the episodes of homelessness must be verified. So it doesn't matter where they're experiencing homelessness, it just needs to be verified. So if they were in a shelter in another community, we would expect the case managers working with them here, the outreach workers, the shelter providers, to attempt to reach out to that shelter or service provider in that other community and get verification of homelessness. The household themselves can also reach out, but we do want an attempt to try to get all the episodes of homelessness verified. But it does not have to be only Orange County episodes of homelessness. Then regarding rapid rehousing, you mentioned that there are additional private organizations that may provide a longer term of assistance. Is there a list of these organizations that may be determined by the BI-SPIT-DAS score? So they're not necessarily private, they're the ones I know are nonprofit organizations, and many of them also participate in coordinated entry, but they've received additional funding that's not continuum of care funding or emergency solutions grant funding to provide rapid rehousing. It may not be longer term. Most that I know is actually shorter term. It's more just kind of a rapid return to housing. So it might be, you know, security deposit and their first month of rent. But some of them are, you know, 3 months, the most common are 3 months, 6 months, 9 months, and 12 months of rental assistance, depending on the program. And I would recommend calling 211 to get a referral for rapid rehousing services if you want a broader list. Okay, well with that was a lot of great questions. I think we're at the top of the hour now, but I really appreciate everybody joining. And as I mentioned, I'll follow up with the recording and the supporting document, you know, all the documents I went through in a follow-up email. And if you're not in the coordinated entry system distribution list, please go ahead and put your email in the chat and I will include you in that information. And you can also follow up to that email if you have any questions about participating in coordinated entry system and you're not currently a coordinated entry system partner. And thank you so much. Have a great day.
Thank you.
Thank
Great
you,
information.
Rebecca.
Everything was very helpful to understand and easy to understand too.
I'm so glad to hear that. Thank you.